We don't have to go to 360 degrees. Now it's time we go the 180. You don't have to climb the highest mountains, for all you're looking for is within you. Open the eyes of your mind, your ears and mouth, as I sing my song. Open the eyes of your mind, your ears and mouth, as you hear my words. Oh, ba-da-da-ba-ba-da-dee, ba-da-da-ba-ba-da-dee. I'll be waiting, I'll be home. Ba-da-da-ba-ba-da-dee, ba-da-da-ba-ba-da-dee. I'll be waiting, I'll be. We still live in yesterday. Many today the waste away, but nevertheless it's never late. Oh, see the times have changed. I thought you knew that these words will never ever wait for you. The world has gone past times of fighting, so drop your guns and your swords and let us live all as one. We all need love and understanding, so drop your guns and your swords and let us live all as one. Oh, ba-da-da-ba-ba-da-dee, ba-da-da-ba-ba-da-dee. I'll be waiting, oh, I'll be. Across the ocean, it's more than just a goddess. We all need one another. Oh, oh. Ba-da-da-ba-ba-da-dee, ba-da-da-ba-ba-da-dee. I'll be waiting for you, for you.
Ọlọ́run alágbára, Ọlọ́run má ṣẹ̀nà. Agbẹ́yìnga afọ́pẹ́ fún yín nítorí ìwà láyé àti ìwà láàyè wa látẹ̀dẹ̀ Ọlọ́run ni. A dúpẹ́ fórí ọ̀fẹ́ tẹ́ fi fún wa lónìí láti gbà tẹ̀yìn Ọlọ́run tẹ́ ti ṣe gbogbo lórí májẹ̀mú tẹ̀yìn Ọlọ́run dúró lórí. Èyí lẹ mú wa padà wá orí kankan, ìdílé kankan, set kankan. A dúpẹ́ lọ́wọ́ yín Ọlọ́run, bàbá gbọ́ ọpẹ́ wa. Fi àwọn tó ti lọ, a fi gbé orúkọ yín ga ni, ògo ni forúkọ yín lókè ọ̀run. Ìjẹ́ wa fi gbogbo ètò náà lé yín lọ́wọ́, bá ó ti máa lọ nínú rẹ̀ máa sìn wá lọ. Ṣáfà tó mí ga wa, ohun gbogbo tá ó ṣe bàbá tẹ́kọ̀ wá látọ̀dọ̀ yín. Gbogbo àyẹ̀wò tá ó ṣe lónìí bàbá bá wa dá sí. Nígbà tá ó parí ohun gbogbo, jẹ́ kí ìmísí àánú yín kẹ́kọ̀ọ́ fara wọn. A dúpẹ́ lọ́wọ́ yín o, àfòkò fọwọ́ yín. Jésù Kristi Olúwa wa.
Thank you. Set program. It is united combination of all sets called Global Raosa under the leadership of Mr. Idowu Adefala, who is the President Global. Can we join our hands together for him while he welcomes us to this program? Mr. President, over to you.
Mr. Moses, the General Secretary, the Global Body Executive. Okay, only I go here. I'm not below. Okay, let me start over again, okay? I say good morning, everyone. I want to start by giving glory to God Almighty. And I, first of all, I'm honored to be here today. And looking at the sets, folks that are here today, go back those memories. But we thank God Almighty that we are here celebrating ourselves. We are not here because we are mourning someone today. I know that to some of us, they felt that this is like a mirage. Is this still happening? But it's God's doing. So first of all, I want to thank all the physicians and the healthcare practitioners that are here. Believe me, you have to schedule to see them. Many of them have to schedule, in fact, I have to schedule the appointment for them to be here about 3-4 months ago. Thank you, Dr. Adolphus. Thank you, Dr. Ajayi. I know Dr. D.J. will meet us very soon as well. So, at the same time, I want to thank all the various sets, 85, 86, 88, 87, down to 2009, that have contributed immensely towards this event. Without you all, we cannot be here today. And to every one of you, even if we contributed all the money and people are not here today, it's a wasted effort. I'm thrilled to see that we only have 250 slots. I'm almost how many people are willing to come. So probably next year we might have to go somewhere else, you know. So, like I said earlier, I'm honored to welcome every one of us to this important medical outreach and health outreach. Especially those of us that were in our 50s. We are getting to that age where we need our spare parts changed or adjusted. The difference is that we are not vehicle, motor vehicle. Mechanic will help us to do that. This is why we are here, and the doctors were educated on that as well. It saddened me to know that my beloved country, the life expectancy over here is about 55 to 65. Where I practice, you will see someone that is 90 and say, no, I want everything done. It's free. Government is going to pay for it. But now the government is not doing over here, we can help ourselves. Folks, I know the first part say medical outreach is not the palliative will come later on. So please, let's focus on medical first. Our physician will talk to us more about it. We need to change our behaviors, modify our behaviors, you know. Some folks saw me drinking water. Listen, this is good. I need to clean my kidney. There is no way to clean kidney. You can't take it to a dry cleaner. Doctor, why? Some people say they give them cucumber with, I don't even know. Listen, the only way you clean your kidney is this, water. Am I making it up? That is the only way you clean your kidney. So please, when we leave here today, what we're going to learn, let's make sure we go with it. Because it saddens me when I see obituary of 50 years old, 55-year-old. It saddens me. We can change it. Don't get me on that about some folks that died in their 80s, in their 90s, yes, well. But vast majority of Nigerians is in their age, 55, 66. That will not be apportioned by God's will. For all the sets, they have donated. Listen, don't feel bad. Don't feel humiliated that the DSS is giving the money. No. I know when it's your turn, you do more than that. You see, we are here together. We are doing this together. One thing we are trying to do is that we are giving out. We are telling each other that let's know each other. When there's a body that you think can help you to hold, call on me. Lean on me. Remember when we were there, when we were going on, we all sat together. You eat together. So please, we take on each other. This is not a good passion. There are other things we're going to do. I'm not talking about this. Please enjoy yourself, have fun. Last year we walked, we're not going to walk today, but please, it's very important as well. Let's walk out, do like the exercise, and it's going to benefit us. Thank you, everyone.
And everybody present here. I don't know what we have to start from, but I just have to start from somewhere. Since my session this school as a principal, we have been enjoying the tremendous assistance from the old students. Actually, the junior school principal is not available. But on behalf of the students and the teachers, we just want to say a big thank you to the body of the ESCO for your assistance so far. May God continue to bless your various homes. And as Oliver this, we continue to ask for more. Please, we continue to look for your assistance in various forms that you think can be of benefit to the students. And we are looking for a situation whereby you can come and give career talk to our students. It is better for you today. That is why we think of giving back to the society. We want them to become better in the future. Please, all student association, create time. Send people to come and talk to our students so that they can emulate, they can start. Even those who are passing out, they know it's compulsory to liaise with the body. Thank you and God bless you.
Can we join our hands together for him? Thank you, sir. We can assure you we will be available. We will keep on doing what we feel is best for the school. Okay, on this note, I am going to hand over the mic to our doctors in the house. We didn't hear them from outside though. They are part of the old students. They will be talking to us on our heads and how to manage it. Truth of the matter is that the more we grow, or as we grow, our immune system begins to go down. But we can take care of it. And that is why within the next 15-20 minutes, they are going to address us. Please, let's listen to them attentively. And if there is need for us when you are, it's time for you to meet them. Don't hide anything. Talk to them freely. They will be of assistance. Thank you all. As I welcome our doctors to speak to us and address the gathering. Thank you, sir. Thank you very much. Honorable Secretary for the Raosa Global. I say good morning to every one of you. Fellow old students of this great school, Ransom Kuti Memorial Grammar School. A day of long speech, medical speech, will not be possible today because of our time. We still have a lot to do. And I happen to be the pioneer president of 88th Set. I worked hand in hand with the Raosa president. In fact, he is a brother indeed. But journey to have the Raosa body come together like this has been a program that we started about 8 years ago with the partner of our brother, who happens to be our junior, in the person of Mr. Kingsley Mokenu. He has done a great deal to make today a possibility. So I would like to speak to you people because of our time. I'll be talking to you on hypertension. Hypertension or high blood pressure is dangerous. It's also a silent killer. It is a silent killer because you may not know that you have it until it renders havoc to the body system.
What is hypertension? Hypertension is when the blood pressure in the artery is higher than normal. That is, if the systolic, which you will see as the upper one, is above 140, and the diastolic, which is the lower one, is above 90. We say that person is hypertension. However, hypertension is in different cadre. However, if care is not taken, because many times it is asymptomatic, it will not show. Their eyes is cloudy. Some will say the way they feel tired. All these are symptoms of hypertension. Hypertension is so bad that it can cause so many things in the body. It can impair vision. When the blood pressure in the eye, when the blood pressure in the eye is so much, it will destroy the eyes. When the blood pressure in the brain is too much, it can burst the artery. It can burst the artery, thereby causing hemorrhagic stroke. That is when you see that one hand or one leg that is affected cannot move again. In this case, it is an irreversible case. Most times, it is irreversible if the the cause of the hemorrhage is severe. Hypertension can also cause diabetes. If the pressure is too much, it can induce diabetes. It can spoil kidney. When the blood pressure is too much in the kidney, it can damage kidney. Thereby, you begin to see situations where people are going for dialysis, they are going for this type of test or this type of other investigations. However, we in the clinical part of the industry, we always say prevention is cheaper and far, far better than cure. Because to maintain hypertension is might be a little money, but it is continuous to manage it, especially when it is severe. I will advise that at this age, many of us who graduated from 80s, 90s, we are above 40 years. And because of aging, because you can, how do you get hypertension? Hypertension can be developed, hypertension can be acquired, hypertension can be inherited, which is genetic. If your father or mother is hypertensive, you might have it. You can develop hypertension when you are stressed. You can develop hypertension when you think too much, especially in this economic situation that we have ourselves. One can develop hypertension easily. Very well. At this our age, you must learn to walk. You must do at least 3,000 steps a day. You must eat healthily. These are not the era where you take big carbohydrates. This is not the era at this level of 40, 50, 35 for women. If you still drink carbonated drinks all the time, you will be doing yourself a great harm than good, because most of these cola contain caffeine, which can trigger hypertension in a person that is prone to have it.
And by the time it is at your random level, when we mean random, means that you have eaten in the morning, probably eaten in the afternoon too. We should be looking at about 170, 180 milligram per DL. I know we also have minimoles that we use in checking, but I think a lot of people still use milligram per dl. Now, by the time your blood sugar is above the normal range, you are bound to have a lot of complications that may come, which you might not have prepared for it. My senior colleague here had said earlier, has said a lot of things about hypertension. Most of the predisposing factors he mentioned earlier are still what could actually induce diabetes. And that was why the Secretary General said, let us listen attentively, because I may not need to repeat everything he had said, but I just want to chip in a few things, because I know some are also diabetic, and we need to identify some of the reasons why we need to be treated, because there are some things that might induce it. He mentioned obesity, hereditary, sedentary lifestyle, and a whole lot. Diets, unaccustomed exercise, and so many. Stress can also induce a lot of medical conditions. So what we are looking at is, how do we manage our condition, being hypertensive, being diabetic, and that is why we are here.
Diabetes again.
More importantly too, prevention is better than cure. And like I keep telling my patients, a stitch in time saves 9. We don't have to wait until we start running helter-skelter. We don't have to wait until we start running from pole to post. If we take charge of our health now, the future will be very, very bright. And by the time we take that step today, we are saving a whole lot of emergencies, medical emergencies in the future. Some complications might want to rear up at a point, but by the time you nip it in the bud, it will be very, very easy for you to manage the situation. On this note, I want to implore every one of us who is here today to please take charge of your health. No one will do it for you. Your good health is not negotiable. You need to take charge of it. We can see a lot with stroke today. Some are down with stroke. Some have had a lot of complications like retinopathy, inability to see clearly, and a lot. Most of the time we might have been having those symptoms. Though sometimes we might tell you that they could be symptomless at the earliest parts of it. But the truth is, even though they are non-communicable diseases, we still have to be very, very alert and conscious about our health. So I want to appeal to each and every one of us that we need to really do a lot about our health, so that we can encourage even the generations that are coming and the generations that are yet to be born, so that they can take our footstep too. Thank you so much for listening, and we want to entertain a few questions before we go into the health check and consultation proper.
It's a set. Dr. Ajayi spoke a lot about hypertension, but I have a friend, anytime we sit down, he would just like, please get me a Coke. He would just quickly, I don't know, he talked about high blood pressure, but what about, but later I found out he has low blood pressure or something. I think Dr. Ajayi should tell us a little about it.
Thank you very much. Many a times, people present with so many things
my colleague talked about diabetes, which is when glucose is high in the body. We have conditions when glucose is low in the body. As a matter of fact, that one is even more severe than diabetes. When you have hypoglycemia, that is, glucose is not enough in the blood, you want to faint. The brain wants to stop working because the fuel for brain is glucose. Just as our car is using fuel, the brain uses glucose to thrive and process everything that is doing. So if glucose is low in an hypoglycemic patient, that person will always live on sugary things. Then there are occasions too when some people are wired to have low blood pressure, and if they check their blood pressure and it is low, before they could get to hospital, normally we say they should take first aid. They take something that contains something like caffeine that can activate the heart so that the heart can continue to beat fast. That does not mean that you that doesn't have hypoglycemia or hypotension should go and be taking coke because your friend is taking coke. Thank you very much. I hope I've been able to answer that question.
All right, thank you so much, Dr. Ajayi. A few more questions before we round up this session. Okay, please come up, madam.
Nkoyo Asuko, 91 cents. Please, my doctor, I want to ask this question. I did not hear you people said about cholesterol. Does cholesterol have anything to do with the high blood pressure? Please.
Thank you very much. Cholesterol has a lot to do with hypertension and has a lot to do with diabetes. When cholesterol is high, what do we mean by high cholesterol? When you go and check, you can't know that your cholesterol is high by mere looking at your face. When you go and check and they do what is called lipid profile, they will tell you that your total cholesterol, if it is more than 200, it is high. And if the high density lipoprotein, that is the good cholesterol, is more than 50 something, it doesn't matter your level. If it is more than 50 something, it will work against the bad cholesterol, which is the low density lipoprotein. But if your low density lipoprotein is high, you can have atherosclerosis, you can have cardiac arrest, you can have anything, including diabetes, because that one is dangerous. It is the low density lipoprotein can cross the membrane of the cell and go and deposit in the blood vessel, thereby creating a clog around it and narrowing it, just like pipe of water. Something is now blocking it and making it narrow. So the pressure will be high with the pumping machine, which is the heart. That means the heart has to be pumping with higher pressure to make it go on to where it is going to. And it can go on and block it and cause local death to all those parts that artery is supplying blood, because they won't get oxygen again. So that is when you begin to feel some body pain around that place, because some neurons will activate the brain. So that is what we are trying to say, is that when you do your total cholesterol and it is more than 200, go and see your doctor. Your doctor will be able to explain things to you. If you have high cholesterol, you will have BP. If you have high cholesterol, you may have diabetes. Thank you.
Thank you, Dr. Ajayi, for that explanation. I hope it is answered. More questions? We have just about 3 minutes to round up this session. Thank you, sir. Please come over. Please hold on, sir. I have just a minute.
I say a big thanks to the organizer of this program. My question is, for diabetic patients who need to manage your sugar intake, can one make use of honey instead of sugar? And does it work?
Thank you very much. Honey is a natural sweetener, yet the biodegradation of honey will still produce glucose. So if you are taking honey at all, it's just to make your mouth sweet small. Use small honey as against glucose, because it's a natural sweetener. So it takes a long time and yields little glucose compared to refined sugar. Are you getting it? But that does not mean that I am diabetic, I am not going to take sugar. But this tea is not sweet enough. I have to put about 4 spoons. You are coming back to the same thing. Are you getting it? The honey you will put in anything should not be more than 1 teaspoon or 1 tablespoon. But teaspoon may be smaller. 1 tablespoon, which is the type you are using to eat rice. That glucose there will be enough to take care of your system. Thank you.
Please come over. I hope your question has been answered, Barrister. Barrister, I hope your question has been answered. All right, sir.
Good morning, everybody. My name is Amal Taiwo, 2006. Permit me to digress a bit from cancer, from hypertension and diabetes. I work in where we have a lot of children, a lot of things happen. So I expect that most of us, we are already parents. So I want to have a clue of what to do if such a thing happen at home. Just yesterday, I was in a school and some of the children were playing at the bush and one of them fell and was passing out. So, you know, naturally we do a lot of things, putting spoon, putting hands in their mouth, tapping them, doing a lot of things, getting them injured. So I don't know the practice. So what do you think we should do instantly as first aid before we take them, instead of just doing all of that we are used to? Thank you.
Thank you very much, my brother. First and foremost, I would like to say there is legal limitation of everything you do. Thank God we have a barrister that came to ask questions. In a school environment, if you are not a medical practitioner that is licensed to take care of health, in such circumstance, it is better you take that child to the hospital, the nearest hospital. Hello, sir. But if you have maybe a nurse in the house, the nurse can do first aid treatment, examination, while you are still rushing that child. Let me also correct one error that has been in the past. If somebody convulses or somebody is fainting, the idea of putting spoon in their mouth is not doing anything good other than to destroy the mouth cells. You are not achieving anything if somebody is convulsing. The only thing you can do, if that person is convulsing slowly and the tongue is outside, you can push the tongue inside so that he or she will not bite the tongue. But consult your doctor in that circumstance. Because the reason is that child, we can't say you should go and give coke to the child. Because the child may be having diabetes, juvenile diabetes. Are you getting it? If the child is diabetic, and because it's not well managed, that's why he or she is fainting. Open for him or her to breathe. That's all. And take that person to the hospital.
you so much, Dr. Ajayi, for that succinct explanation. I think we have just one left. Any more questions? That's the last one.
To Kafo, I'm 92 sets. I'm here to ask a question. Like some, they always have a low sugar. So I want to ask the doctor, what usually causes someone to have a low sugar?
You heard earlier, I think it was explained by Dr. Ajayi, or maybe you weren't attentive because of the noise around you. Low blood sugar can be hereditary. Low blood sugar can also probably be developed over time as a result of probably inadequate glucose supply in the body. So having low glucose level, which in medical terms we call it hypoglycemia. Hypoglycemia might be very, very dangerous. In fact, it is more severe, worse than even diabetes, which is the high blood glucose level. So you need to take more of the glucose because your brain needs more glucose to work. Just like the engine of a car, it needs fuel, it needs water, it needs other things. That's why the radiator is there, that's why the oil is there, for the fuel, for the oil, and a lot of other things, so that it can work its synergy. So glucose is a major ingredient in the body, and if it is lacking in the blood, there will be a lot of problem, and that can cause complications at any point in time. Some people might pass out, some people might be panting, some might feel dizzy, some at a point might be partially unconscious, and some can go into full unconsciousness. So at that point, what you need to do is, if you are a medical personnel, give a first aid. And if you cannot give a first aid, please rush that person to the nearest healthcare facility so that they can do the needful. And as soon as they get there, being an emergency, a blood sugar test should be conducted. And the moment the blood is below probably 60 mg per dl or even below 70, depending on the individual, that simply means that the person has hypoglycemia, and at that point the blood sugar has to be raised. So that is left to the doctor and the clinicians there. I hope I've answered your question, ma'am. All right, thank you so much for having you here. I want to also crave your indulgence at this point that we have to go into the next session, which is a consultation. So there is a space very close by which you are going to see us, and it's going to be very brief. We have so many on ground, so we don't need to take too much time. So whatever is your complaint, whatever you want to discuss with the doctor, feel very free, open up, let us hit the nail on the head. And we don't have much time, so that we can leave here as soon as possible. Thank you so much. At this point, I want to hand over to the Secretary General of Raosa, and I want us to give him a resounding applause. Thank you so much, sir.
Thank you, Doctor. So we are going to the second section, and this is where the arrangement will be.
Ẹranko igbó wọn yin bàbá lókè, àwọn aláìní, àwọn tó ti ní wọ́n yin bàbá lókè. Kò ṣẹ́gbà tí kò bá ṣèyàn kò tó mọ̀ pé bàbá ń bẹ lókè. Kò ṣẹ́gbà tí kò bá ṣèyàn kò tó mọ̀ pé lóòótọ́ ń bẹ lókè. You don't have to wait till you feel the pain. You can start right now. It's not too late. for your logo. To leave this world a better place. Kò ṣẹ́gbà tí kò bá ṣe ọkọ̀ tó mọ̀ pé bàbá ń bẹ lókè. Kò ṣẹ́gbà tí kò bá ṣe ọkọ̀ tó mọ̀ pé lóòótọ́ ń bẹ lókè. You don't have to wait till you feel the pain. You can start right now. It's not too late. It's not too late. It's not too late to be grateful. Oh, me, be more safe than baby, Baba. Sorrow, but we're laughing about me, yeah. I'm one shiny, I'm one shiny, alone my daddy. Help me, I can't open every door and every window. So get on, Satan. There is fire on the mountain, and nobody seems to be on the run. Oh, there is fire on the mountain top, and no one is running. I wake up in the morning, tell you what I see on my TV screen. I see the blood of an innocent child, and everybody's watching. Now I'm looking out my window, and what do I see? I see an army of a soldier man marching across the street. Hey, hey, Mr. Soldier Man, tomorrow is the day you go to war. Boy, you are fighting for another man's guns, and you don't even know him. Ooh, what did it say to make you so blind to your conscience and reason? Could it be love for your country, or to you. 'Cause you are fooling with a dead man's corpse, and you don't know what you do. So you say you have a lover, and you love her like no other. So you buy her a diamond that someone has died on. Don't you think there's something wrong with this? Tell me, who's responsible for what we teach our children? Is it the internet or the stars on television? Why, oh, why? Why, oh, why, oh? Oh, so little Lucy turned 16, and like the movie she's been seeing, she has a lover in her daddy. She can't tell nobody till she makes the evening news. For there is fire on the mountain, and there is nobody. Oh, there is fire on the mountain top, and no one is surrounding. Oh yes. One day the river will overflow, and there'll be nowhere for us to go, and we will run, wishing we had put out the fire.